Because beyond regulations, a major issue is access to these services. Organ transplantation is quite expensive, and the truth is that many Nigerians, I don't want to say most, can't simply afford it. So what are the options available, to ensure that it is more accessible, more affordable to Nigerians? I know that recently there's been this talk of, subsidy, but I think, is it 10 or 12 centers across the country? Considering our population, this is unlikely to scratch the surface.
Very much. Let me add a word or two on the registry. Let's just narrow down our thinking about keeping a centralized register. The registry is supposed to be robust. It should contain information about the organ transplantation in the center, the outcome of the transplant, what happened to the recipient, what happened to the donor on short-term basis and on long-term basis. Registry is supposed to be comprehensive, and it is the registry that the regulators will look at and decide what is the fate of an organ transplantation center. In developed countries, there are centers that are closed down because of the records from the registry. Maybe the numbers are not enough, so government is spending a lot of money on sustaining a program that taking a lot of money and then not delivering. So centers are closed, and then patients are referred to a nearby centers. They have regional organ transplant centers. And then sometimes outcome. What is the outcome of the organ transplantation? The registry will say, you have done 10 transplants in first quarter of 2025. How many of them survived the first month, the first 6 months, the first 1 year, and so on. So the registry is robust. It contains a lot of information about the process of organ donation, and it's good to have one in Nigeria. And we have to start from somewhere. And concerning the accessibility to organ transplantation, I agree with you. Organ transplantation is a very expensive procedure, and currently in Nigeria, it's not affordable to many Nigerians. And there are a lot of options where the government, the individuals, and the communities can come in and make the process more affordable and more accessible to Nigerians. The government have started this subsidized dialysis. Is a welcome development, and I want to tell you that my center is part of the benefiting centers, and I've seen the impact. Many people that I thought cannot afford are now able to get the service. 12,000 naira per dialysis session, which is a very good development. And I heard from the implementing committee of this subsidy that they are just beginning. It's a pilot, and they are going to expand. So I have the hope that in near future, many more centers are going to be involved. And with affordable dialysis, patients can be able to survive and reach the time when they need an organ. So I want to advise the government to start planning on organ transplant centers ahead, because with subsidized dialysis, many more kidney failure patients will survive for a longer period of time when they need kidney transplantation, for example. So if the government is thinking ahead, I can advise. So from the federal government institutions, I'm happy Professor Abiodun is here. We can identify centers of excellence in organ and tissue transplantation, for example, in each geopolitical zones of the country. And then the government shall invest in those centers in terms of manpower, in terms of infrastructure, in terms of whatever is needed to boost the capacity of those centers. So if the government centers are up and doing, I'm sure people are given alternatives to private sector, like Dr. Otabo's center and others, where they charge huge amount of money. I can tell you, in my center, because it is a government center, we charge 1/3 of what Dr. Otabo is charging. You can get kidney transplant at American Teaching Hospital in less than 10 million naira. And I'm sure you cannot get it at a private center in less than 20 million naira. So these are things that government can come in and equip and provide a service in its own centers. It doesn't have to subsidize, but the mere thing that is in public center, it makes things easier and make the charges lower than the private. And the other thing is a philanthropist. There are a lot of good people in Nigeria that can assist. In fact, why the transplant procedure is expensive is because of the issues around the organ transplantation. The laboratory services, especially tissue typing, the drugs after the transplant, the surgical equipment needed. These are the things that make the procedure expensive. Let me give you an example. At American Teaching Hospital, at one time, NNPC donated the tissue typing laboratory. So that has made the transplantation easy because the tissue typing service is made available at a government hospital at a subsidized rate. So more patients are more accessible. So this example of corporate bodies assisting in establishing center of excellence. Another thing are individual philanthropists. This can also go a long way in helping. They don't have to give money to the recipient or give money to the donor or give money to individual. But by buying and donating the essential equipment and drugs and reagents needed to facilitate the organ donation, they will now impact on the subsidy on the patient, and because the cost will be reduced. They can donate, for example, and say we're donating reagent for 20 laboratory tests, but the patient must get it at the 50% of the official rate. And the centers, the institutions will accept that because it's donation. So these are the things that we can pursue. The government should do it. The individuals, the corporate organization should come in, and the NGOs should also come in. Kidney foundations, patient associations, and so on. They cannot come in and assist and make the procedure accessible to Nigerians.